as you work with the inner person and all the scared and upset parts of them, they become less likely to project their issues on other people. So if they, for example, if people say, all these people I work with are such assholes, and you go like, they say they really scare you, they upset you, and you deal with their own triggers of what upsets them so much, they start maybe seeing these people as just flawed human beings rather than people have it in for them. So that's very relevant for trauma, of course, because traumatized people are always feel hurt by somebody all the time. Because when you're traumatized, you get very, very vulnerable to take other people's emotions onto yourself and to take it very personally. So the issue when you're traumatized is that your whole alarm system is always ringing. And so any piece of affect you pick up from around you. So you tend to get very vulnerable to respond to other people who are upset or other people who are angry or other people who are critical, and you're you're always on guard, and so you go through life getting hurt a lot. They're very sensitive. They actually, it goes both ways. Sometimes they get very insensitive. They feel nothing, and the DSM-5 has made some progress in that, in really distinguishing these two variations of trauma. One is the hyperreactivity, the other one is the shutting down. And oftentimes many people have a combination. They're shut down part of the time and hyperreactive other parts of the time. And so a very important part of overcoming trauma is to stabilize that internal world of yourself where you're less scared. And that involves some psychotherapeutic issues. Also, types in my practice really involves oftentimes some neurofeedback, where you calm the brain down, so you are not so reactive to everything around you. Getting to know your body, getting to own your body. All these are aspects of getting less vulnerable to other people's emotions. So it becomes more and more possible to say, "Oh, you're angry, and I am not. You're you're a bloviating, self-important person, and I'm not. That's your problem, not mine." I take it to a neuroscience point of view. You need to build up what's called the midline structures of the cortex, which the areas of the brain having to do with self-awareness and self-observation. And so once you really know who you are and what your feelings are, you can say, "Huh, this guy's having feelings, but they don't match my feelings." As long as you're wide open and very vulnerable, other people's feelings come right in and hijack you. But you see this after meditation. So after people go through meditation retreats, they go back to the same old environment, and they just shake their head and say, "Oh, there he goes again." Instead of going like looking for a confrontation, you go like, "That person having a problem," and that's very strongly correlated with activation of the midline structure of the brain, which you can activate when you do prolonged meditation and yoga and introspective work. But to my mind, this has really been one of the great advances in what we have learned in the last 20 years. So this is the whole world of mindfulness, the world of the Mind and Life Institute, the visits from the Dalai Lama to scientific organization, is to really enhance people's capacity to be mindful and to be aware of what goes on inside of themselves and to meet themselves.